Hello friends, welcome to Otica Healthcare Private Limited. Today we are going to demonstrate an unboxing of Contec CMS 5100 machine. So we are going to open the device. This is the main unit and company gives a spare part box inside, or we can say accessories box. We will remove this from this poly bag, and here company has given the accessories. This device is made for a pediatric or a neonatal patient. That's why company has given the neonatal probe. You can see there is a difference between adult probe and this is a wrap around neonatal probe. So this neonatal probe can be useful in pediatric patient, and the device comes with the temperature probe, the user manual, the NIBP tube. It comes with a power cable, and Otica company has given the spare part. There is one neonatal NIBP cuff and this one is a pediatric cuff. So this device is modified for the dedication to the neonatal and a pediatric patient. So it comes with a different accessories compared to the regular one, and we are going to open this. So you can use this device in the neonatal patient. So this comes with a neonatal NIBP cuff, and this one is the pediatric cuff. Now we are going to switch on the device from the yellow button. You have to long press the device, so the device will getting switch on. There are the connection port over here. You have to connect this orange port in the temperature probe. Then there is a yellow cord which is for the SpO2. You have to make sure you are using the proper connection to the proper cable, and do not rotate or twist the cable. You just need to pull and push. Then we are going to attach the NIBP tube over here. Now you can see whenever the device is modified, there are two male to male connector. So you just need to cut this connector from here, because this is modified for the neonatal patient. So you have to cut this connector from the cable, and you can attach this connector directly to the tube. Make sure you are doing a proper and thorough connection between the tube and the connector. Then it will work properly, otherwise there will be some error. You have to make sure to remove this old connector from the cuff and connect directly to male connector into the silicone tube. So now we will see the device is switched on, and to check the SpO2, we can use this probe in adult also, but this is dedicatedly made for neonatal patient. So we are going to attach the SpO2 probe. We are just putting on it. It will give the temperature over here on the temperature screen, and you can see the plethysmograph has started showing the graph, and the SpO2 and pulse rate will come very soon. Yeah, it's come, and the bar graph is there, plethysmograph is there. And to check the BP, you have to press the BP button, NIBP button here. And to show, I'll just remove my hand. There are 5 buttons given over here: main menu, NIBP, freeze, silence, and main. So whenever you are into the any menu, and if you want to come to the main screen, you have to press this button. And because we have not attached the finger over here, the machine is giving alarm by red, and it is also giving the sound. If you want to make the sound silence, you have to put this silence button. You have to press the button and it will be silence. These are the cursor. OK is the OK button, and this is going for up and down. So when you using the neonatal probe, you have to make sure that the type of patient, you have to press the menu button, you have to go to setting, put OK button, again go to setup, then you have to select the patient type. This is very important point. If you will not select the patient type here as a neonatal or a pediatric, it will give you the adult pressure in blood pressure, so it will be harmful to the baby. So you have to make sure that the selected patient is the correct type. Like if you are applying this machine to adult, you have to select adult, neonatal and pediatric. So we will put here neonatal here, and then you have to come to exit, or you can also press directly main button, so it will bring you to the main screen. It is very important to change the patient type, otherwise it will create damage to the baby. If the patient type is adult and you have attached the neonatal cuff, the pressure in the neonatal cuff will be very high and it will damage to the patient, neonatal patient. So make sure you change the patient type and read this menu carefully. If you have any doubt, you can contact us back about this device. Thank you for watching.